May discussions and decisions be infused with the values that honor you, Lord, and serve to accomplish your mission. So, Father, we praise you and thank you for your presence with us. We know that when we are together, you always have a purpose and you have a divine agenda. And we love you for that. That even when we do what you have called us to do as your stewards, the results are often much greater than we ever imagined. So, Father, you are always faithful and you are always good. You receive our limited offerings of knowledge and understanding, and you use them to meet the needs of thousands. So our prayer today is that your will be done. Take what we have prepared and multiply our efforts as only you can. Steer our intentions to align with your will. Remind us of your faithful provision, and may all glory be yours when we achieve the results you have prepared for us. So blanket us with your peace. Keep us centered in you and guard our hearts and minds from pride and selfishness. And may your love, Father, be the guiding light for all we set out to accomplish and hope to achieve. And we offer this prayer in the name of the Father and of the Son and of the Holy Spirit. Amen.
Amen.
Pledge of Allegiance. Thank you, George. All right, can I hear a motion for approval of the chairman's meeting minutes dated November 20th, the regular monthly meeting minutes dated November 21st, and a December disbursement of,
$1,325,696.87.
Second.
all in favor?
Aye.
So normally, I don't say much at the chairman's time, okay, here. But as I think everybody here knows, this is my last meeting as a district trustee, and after 10 years. And so I have some things to say tonight that I want to. First of all, I want to thank the residents of this county for allowing me to have the opportunity to do this and voting for me, because it's been an amazing opportunity. The agencies, I want to thank the agencies. They're our partners that do the real work here in the county. We help them, we support them, but they're the ones out on the front lines every day, and it's an honor to know and be able to support so many good agencies. The collaboration and cooperation in this county is unbelievable. If you've lived other places and worked with other, you know this is unique here, and it's really special to see. So keep up the good work, and actually what you're doing is you're working on our strategic plan, so we appreciate it. To the staff, they're kind of the unsung heroes of the district here, I think. I don't think any of us trustees really realize all the work that you guys do on a daily basis. And I do know I get a lot of feedback from our partner agencies that you do work as partners. You do work with them very well. And the respect that people have for every one of you is great. And you ought to feel very, very proud about that. And it's been an honor to work with all of you, too. Some longer than others, but it's been great to work with you. The trustees, both past and present, and I see Anne Marie's here as a past trustee. I'd like to thank you, for those who've been here, for the confidence in allowing me to be chairman for the last 8 years. That's really been a very, very special thing for me. And I started thinking back over all the things that we've accomplished, and not me, but we as a group. And I think back 2018, we had a year, a very rigorous process, and in 1 year, we identified and selected somebody to come in as a partner for the hospital with us. Not many government agencies get something like that done in a year. And that was working with not just this board, but with the hospital board as well. So it was really quite an accomplishment to do that. And thank God we did, because who would have ever predicted that we'd have a pandemic shortly after that? And I can tell you matter-of-factly, our hospital would not have survived that. It would not have survived that. So we were very thankful. And unfortunately, we lost a lot of lives during the pandemic, but they saved so many more that could have been lost. Being able to have the resources they did to fly in oxygen, to fly in respirators and all that, we couldn't have done that as a standalone. So we were very smart in doing that when we did, weren't we? But I'm very proud also of the hospital that we selected. I'm proud that it's one of the top 25 hospitals in Florida now. That's a pretty neat thing. It's in the top 10 in the country for fetal and maternal health for Black women. I don't know if many people knew that, but I think that that's a really amazing thing and so important for our community. And yes, I'm an advocate for the hospital, but I'm also an advocate for every one of our agencies out there. And I talk them up all the time, just like I do the hospital. For those of you that were around, we also had a controversial change with the Gifford Health Center. Yeah, remember that? It was not necessarily a very smooth thing that happened, but we saw the vision to change it from just adults to a full health center, thanks to one of our partners, TCCH. And now they do adult, pediatric, they do behavioral health, they do vision. It's really amazing. And so what an advantage for that part of our county to have that. At the Up Center, in their brand new Up Center that they were building, they wanted a clinic. They were gonna go run a clinic by themselves. And we said, whoa, wait a minute. Why don't you use people that know how to do that? And so again, TCCH stood up and they said, we'll do it. I think that's pretty great. There was a gap identified in mental health for intensive outpatient. And between the Community Foundation, the United Way, Johns Island, and this organization, Cleveland Clinic, our partner, stepped up and started an IOP for 13 to 17-year-olds, and then it's expanded since then. The mental health court got in trouble. Who did they come to? And yes, we supported them, and it's really good. Healthy Start with the femurs, if you remember that. That was a big thing for us to be able to do. Public Guardians was in trouble, and this organization stood up and do that. Some people say that we've done mission creep over the years and that we shouldn't have probably done some of the things that we did. I have some different takes on it. I look at Hope for Families, and people would say that was mission creep, that we support an intake person. But I can tell you that when they get families in there, less than 20% of them have a primary care doctor. But when they're there, 100% of those people, adults and children, have primary care, and they have mental health support. Homelessness is traumatic for children and adults, okay? And so they're getting their care there because we supported doing that. That's important. I look at Camp Haven, okay? There's another one. Drug tests and mental health support for men so that they can become productive members of society again. That's a really important thing. So there's a lot of things like that. This group is a lot of different personalities. And over the years, it's been continued to be a lot of different personalities, and it will be. And we get twice a month to meet and can't talk in between. And the challenge of Sunshine, coming from a corporate world, the challenge of Sunshine has been really interesting, okay? Not to be able to call up another trustee and say, what do you think about this, or how are we gonna do that? But to have to do that through twice a month and open meetings like this. And we've accomplished a lot in those confines, okay? The success of it, and I believe that the success of it is when everybody, all the trustees, are focused on what the mission is. And the mission is to be able to create improving the health of the IRC residents. That is our mission. And you might think this is a little goofy, okay? But I was thinking that we're called trustees, okay? We're not commissioners, and we're not on the city council or council members. We're trustees, and I happen to take that as we are entrusted the county residents and trust us to help them make sure that we can follow our mission and improve the health of this county. They trust us to do that. They also trust us to do that in an accountable way with the funding that we get through taxes. And I believe that we have done both over the years very, very well. So what I want to say is good luck to all of you as you continue on. Continue to keep the mission in mind, okay, where we are. We are politicians, we are elected, but we're not politicians. And keep that in mind as well. There's no room here for political agendas or personal agendas. It's the focus on our county. And that's what I wanted to say. So thank you for bearing with me. I'll turn that over to Jennifer now, District Council report.
All righty, thank you, Madam Chair. My report's not nearly as interesting to follow, but I do have some exciting news. We closed on the facility today, the property that the district has purchased for the Women's Sober Living Facility. Got everything dispersed today, and just really excited to let you all know that. The state has confirmed, the attorney we're working with there, that they lifted the LURA and have made those recordings, and so we are fully closed as of about 2 hours ago.
Another accomplishment. Good job, guys.
Yes, and so that'll be more work for the beginning of the year to move forward with what we're going to utilize that property for, but the real estate transaction is complete as of today. As always, I've also responded to questions from each of you as they arise throughout the month pertaining to various matters, and continue to be available to each of you. If you do have questions or need to meet with me, you do know how to find me. I continue to review the annual deadlines and deliverables due to the district under the lease with Indian River Cleveland Clinic, and have continued to respond with questions on that as those arise. As you're aware, we've entered into a lease with VCOM to lease the Human Services Building, and I know the district office is making really good progress to help VCOM to prepare to occupy the building. We've continued to assist with your strategic planning efforts and remain available to each of you in this regard. And really, I think that's about the extent of my report for this month. A lot of my time this last month has been dedicated towards getting this closing completed that we finished this afternoon. Any questions for me at this time?
I do. I had sent an email on December 9th concerning a topic that actually, given the transitional leadership we're going to be experiencing, this may be a good opportunity to get explored. And that is the role the chairman has with the two hats that get worn. Being an ex officio member of Cleveland Clinic's board, Indian River, and our board, our missions are aligned, okay? So, you know, when lawyers use the word conflict of interest, it's not necessarily as dramatic as it might seem in the non-legal world. But there's technically, our interests aren't perfect together. So there are times where whoever is sitting in that seat is going to have a situation where the two hats have differing interests that need to be served. And I don't know the answer to that. I'm not suggesting an answer by raising the question. The email I had sent Jennifer and Frank was just, perhaps Jennifer can render a legal opinion for us as to how the governing documents, I've reviewed the lease and the substitution agreement, and it doesn't speak to this topic. I know, Mary Beth, you've done a very good job in maintaining the confidentiality of serving on the hospital board, but I think that as we move forward, this relationship is growing and maturing, and I think part of that process is appropriate for us to understand whoever's sitting in that seat, the interrelationship of those two responsibilities. So the ask is whether or not we're interested in having Jennifer explore, by way of an opinion letter, this topic so that whoever is going to be sitting in the chair come January, February of next year is that much better equipped. To deal with issues that may come up because you're representing two entities when you're sitting in that chair.
I did respond to Paul's question, and some of the question had to do with, was this considered in the 2018 transaction? And I said, there was quite a bit of discussion, quite a bit of phone conversations, and we had a team of attorneys involved. And this was part of the transaction that was structured with regard to selecting whomever was going to operate the hospital, that we would have a person from the district sit on that board, and that person would be whoever the board chair is. And so one of the things I said to Paul was that the reason those meetings are not open and that the chair is not able to come back and provide the district trustees and the public with everything that's discussed at that meeting is because they don't operate in the sunshine. And none of the entities that we solicited or considered to operate the hospital would agree to operate in the sunshine. That was something that the old hospital, our local hospital, was required to do because of the district lease. So we did talk, I did respond to that. And then we also, I mentioned, one of the things we continue to review, and I even think it may be in your ethics course that you've all recently reviewed, is the concept of a conflict of interest, whether it's this potential conflict of interest or something else you may be involved in the community. And the duty to disclose a conflict when you feel that you have one, and to recuse yourself from a vote and follow the process that's outlined in our governing documents, as well as the ethics video that each of you have reviewed. We've also talked a lot over the years in concept that your trustee hat never comes off, whatever you're doing in the community. So I responded in that regard. And then one of the other things I said to Paul was, certainly we can explore this, but that I would need the consent of the board to expend the time to do it.
That was the point of
Yes.
my inquiry now, is just have it explored as it relates to our governing documents, our responsibilities in the relationship with Cleveland Clinic. And recusing and having learned something in the process that might be material to the district and what to do with that information, or being in a position where is very different. And I just, think that it's something that we need to have clarified, given our relationship with Cleveland Clinic. Again, I'm not looking to invade their confidentiality during the meetings. I understand that sunshine does not apply. I'm just asking that it be explored so that whoever does take the chair is that much better equipped.
To your end, though, and I would agree to some extent that if somebody is sitting in the seat and has not been on boards and doesn't understand fiduciary responsibility that you have to a board, whether you're sitting on multiple boards, I think it's very appropriate to help those people understand that, and Jennifer probably has the responsibility to do that, to make sure that people understand that. You can't come in and say, oh, well, look here's the open books that we just saw. I mean, that's not following the fiduciary responsibility you have for being part of that board. So I think from that perspective, maybe some learning and education is helpful.
I would be comfortable with that purely from an informational education purpose, so that, again, to Paul, what he said, anybody who's going to sit in that seat, if it, for whatever reason, would be me, I'd want to know what I can and what I can't, and information to serve both appropriately.
And again, this is no idea towards forcing anything on anybody, just an understanding is all.
So
Are you making a motion?
Yeah.
I'll make that motion. I move that we ask for an opinion letter from Counsel Jennifer Pesky addressing potential conflicts of interest that may exist while the chairman is sitting on the Cleveland Clinic Indian River Hospital Board, in order to have that individual be as prepared as possible.
I don't know if you'll let me add this, outlining the role.
Outlining the roles, so that that person is
Right.
as prepared as can be.
Right, transparent, yep.
Does that actually have to be a motion? Do we have to have an action item? I think that could just be an informational situation for whomever is going to be in that role. we could just have that conversation, I suppose, but I don't think we have to.
Well, it kind of sounds like Jennifer is asking for
Yeah,
at least a consensus
If I'm
from
gonna
us for her to go
expend time, I
forward.
can't take direction from one trustee to do
Right.
so. So you as a board just have to give me authority to do that since I'm gonna expend time to do the work, that's all.
So then explain the motion again specifically, please.
For council to define and assist in the understanding of the dual relationship, the dual responsibilities that the chairman will have in that dual role of chairman of the trustees and the ex officio member of the hospital, Indian River County, Cleveland Clinic, Indian River County's board, so that that individual better understands their role, their responsibilities, their liabilities, and obligations to the taxpayers and to the board, the district.
Before we vote on that, I have a question, perhaps.
we need to do a
need to do a
motion,
second.
we need to do a second before we can, has there been a second? Second, okay.
I have
Now,
a question. So Karen has a special role as well, overseeing the property of the Indian River Hospital?
The integrity,
Integrity, yes. Now, is that,
oversight of the
yes,
property.
is that,
it's oversight
that's a
of-
different role, but it
Commitment Integrity
can
Committee.
apply? Or can she report?
She could,
That
no,
position.
they report back. In fact, we just got a report, and that's required of that committee. So that doesn't have the same, I don't think that has the same issue that Paul's concerned about at all.
No, that's limited just to how they're fulfilling their capital improvement
Right.
requirement.
Which is another commitment in the lease that they made.
Okay.
Good question, but I don't
All
think
the
that
substitution.
goes to this concern.
How the capital, as well as making sure that they are continuing to provide the services that we have outlined in the substitution agreement.
In fact, it's a requirement you do report back, because you're representing the district. You have to report and tell us how things are, right?
Correct. And it comes back from the committee, not from me, but a committee report.
Thank you.
Okay, so there's a motion, a second. Any further discussion? All right, all in favor?
aye,
Aye.
Aye.
Any opposed? Motion carries. I will work on that for you all and bring it back to you as soon as possible.
Okay? Anything else for Jennifer? Okay, moving along with the financial statement. Michael?
Everything's good.
and we're done.
As we wind down the calendar year, I am pleased to report the district's financials remain in very good condition. You all received a complete set of financials in the packet. And as usual, let's go ahead and look at the last 4 pages of that packet. On the last page, you'll see the summary of the district's investment and cash holdings through November 30th. That top section shows that our net ad valorem tax receipts for the fiscal year jumped significantly from last month to $7,860,521. That number represents 37.2% of the anticipated total tax revenue. As is customary, Mr. Isley has continued to receive large distributions from the county throughout December, so we'll see another huge jump. As I've previously noted, and I think you all are aware, the majority of our ad valorem tax revenue is received in the last 2 months of the calendar year. Huge kudos to the homeowners in Indian River County who make those tax payments, shortly after they receive their bills, get them in early. Section 1 of that summary updates our laddered U.S. Treasuries. Those totaled on November 30th, $7,878,362. And the maturity dates of those T-bills are shown on the far right column. You can see how they ladder up month by month. Section 2 updates the district's holdings in the preferred deposit pool. That's the money market account. And you'll see that as of November 30th, the PDP held $7,229,955. And the last section, just the amount of money we have in the bank accounts locally, our operating accounts. Altogether, district's investment in cash holdings totaled $15,769,761. If you turn back 3 pages, that starts the year-to-date expense versus budget spreadsheet. And if you note the header on the 2 right columns, it shows that expenditures, if they had been realized or distributed over an even 12-month cycle, they'd be at 16.67%, 2 months, for all of our funded programs and for the district's administrative costs. As usual, when you scan through, you're going to see a wide variety of percentages. Some are zero. We have 2 or 3 agencies that request quarterly reimbursements and aren't going to even ask for money until toward the end of the 3rd quarter. Others may be a little bit ahead, but that all evens out over time, and we'll monitor that month by month throughout the fiscal year. Go to the 3rd page of that spreadsheet, where you'll find the total for all program expenses through November, and that number was $2,683,348, and that computes, as it shows, to 14.2% of the approved total program budget. The bottom half of that 3rd page shows that our administrative expenses totaled $163,772, and that represents 12.3 of the approved budget. Combined admin and program expenses totaled $2,847,120 at 14.1% of the approved budget. And always, I just add as a point of comparison, in November, through November of the 23-24, last year's fiscal year, our total expenses were at 14.8%. I don't think there's anything in there that needs explanation, but you've got them, and I'm happy to answer any questions you might have. And outside of that, that concludes my report.
Any questions, comments for Michael? Okay. Moving along, the Executive Director report. Frank.
Thank you, Madam Chair. Progress on our strategic goals continues to gain momentum as we work to enhance healthcare access, improve outcomes, and invest in the well-being of Indian River County residents. I'm going to go through some key initiatives that we're working on. First one is expanding access to primary care and mental health services. So we're making strides in establishing a comprehensive baseline count of primary care and mental health providers in Indian River County. This effort involves close collaboration with local primary care providers and cross-referencing data from AHCA's statewide Medicaid managed care database, because we want to ensure we have providers who accept Medicaid in our county. This initiative aims to ensure resources align with the community needs and allow us to track improvements in primary care and mental health access over time. Second, enhancing healthcare services for the uninsured and underinsured. Through partnerships with our funded agencies, we've achieved a 7.6% increase in hospital district registrations compared to the same time last year. This progress underscores our commitment to serving the uninsured, underinsured, and the ALICE, the asset-limited, income-constrained employed populations, by expanding access to essential healthcare services. Third, implementing preventive health initiatives. A milestone in one of our preventive health efforts is the impending acquisition, which is now completed acquisition, of our property at 620 and 650 10th Street in Vero Beach. Once finalized, this location will house a woman's sober living residence with a capacity to accommodate up to 30 women. There's nothing like this in our county. This residence will provide a safe, structured, and supportive environment for women recovering from substance use disorders, helping them transition from treatment programs or unstable living situations to independent, productive, and substance-free lives. Additional preventive health initiatives aim to reduce hospitalizations by addressing preventable conditions such as diabetes, hypertension, obesity, and common cancers, where we're higher than Florida average with a lot of these metrics right now. We'll begin this work in 2025, which is in a couple weeks. Advocating for legislative support. Recognizing the importance of policy in shaping access to quality health care for Indian River County residents, we have initiated steps towards legislative advocacy. Last week, we met with a potential lobbyist to discuss strategies for championing healthcare policies that directly benefit Indian River County residents. Securing federal and state grant funding. As an independent special taxing district, we are uniquely positioned to leverage federal grants and state funding to support essential healthcare services. And we're not competing with any of the local agencies we support. This is beyond that. We recently met with an experienced grant writer to develop a scope of work and discuss proposals aimed at securing these resources. Our ultimate goal is to reduce reliance on local taxes. Reduce reliance on local taxes. Reduce reliance on local taxes. All right, I'll stop there. While making sustainable investments in community health. Exploring innovative pilot programs. Finally, we're exploring pilot programs in collaboration with insurance providers and local healthcare providers. These programs aim to enhance reimbursement structures tied to improving health outcomes, fostering a more value-driven healthcare system in our community. As we advance these initiatives, our focus remains steadfast on creating measurable, lasting improvements in the health and well-being of all Indian River County residents. Now, we had yesterday at the chairman's workshop, chairman's meeting, we had a couple folks. I think it was a really great meeting. We had a lot of folks present who I think learned a lot about the hospital district and what we do. So in the spirit of that, we had a gentleman there, Mr. Kennedy, and a lady there, Ms. Corrigan. So in the process of us, and I think we've made big strides over the past year to educate and inform the public about what the district does, what our impact is. I think we need to go further. And that's some of the feedback we received yesterday. So in the spirit of that, I'm going to tell a little story. And this involves Treasure Coast Community Health. And this involves a young lady named Maritza. She's a patient whose lifelong relationship with Treasure Coast Community Health embodies the profound impact of community-focused care and the importance of the hospital district's ongoing support for organizations like TCCH. TCCH was established in 1993 as Fellsmere Medical Center. Maybe many of you know that. I did not. It was founded to address the healthcare needs of seasonal and migrant citrus and ranching workers and their families. For many, TCCH was the only option for affordable, high-quality healthcare, providing a lifeline for individuals who otherwise might have gone without medical attention. Over time, some of these families chose to stay in Fellsmere, building permanent lives and creating a legacy of health and opportunity for future generations. Maritza's family was one of those. I quote her, "When my parents came to Fellsmere, they worked in agriculture, and the only care they knew was Treasure Coast Community Health. The care I received at TCCH started when I was born, and 25 years later, she's still a patient. This remarkable continuity of care is made possible by the commitment of TCCH and the essential support they receive from the hospital district. For over 30 years, TCCH has been more than just a healthcare provider. It's been a cornerstone of the community health network, adapting to meet the growing and changing needs of residents like Maritza. Through partnerships and funding, the hospital district has enabled TCCH to expand its services, maintain accessible care for underserved populations, and sustain its mission to ensure no one in Fellsmere or in IRC is left behind. Now at 25 years old, Maritza is continuing her family's legacy with her own daughter, and I quote her again. At 2 months old, my daughter was diagnosed with something I would have never imagined. Treasure Coast Community Health saved her life. Her story is a powerful testament of the value of long-term investment in community health. Without the dedicated support of the hospital district, TCCH could not have provided care for Maritza's family across generations. This partnership is a shining example of what happens when public resources are channeled into strengthening community health. It ensures that providers like TCCH can deliver not just episodic care, but a lifetime of support, addressing the many healthcare needs of individuals and families with compassion and expertise. This story exemplifies why our investments matter so deeply. Through organizations like TCCH and others, we're not just addressing immediate health needs. We're building a healthier, more resilient community, one family at a time. By ensuring access to affordable, high-quality health care, the hospital district is empowering families like Maritza's to thrive, contribute, and live healthier, more fulfilling lives. Maritza's journey reminds us that healthcare is not a short-term fix. It is a long-term commitment. It is through stories like hers that we see the real impact of our mission, creating a future where everyone has the opportunity to live their healthiest life. The hospital district's support for TCCH and others has made a future that is possible for Maritza and countless others. And it is this commitment that continues to strengthen the foundation of our community. Thank you.
May I?
Go ahead.
I was going to ask a question, if I may. I'm going to want to back up to, we now own the facility. Can you do a quick recap? I mean, we generically talked about it. I know we got a couple $100,000 off the price because there's work that needs to be done on the space. Just speak real quickly to that. But more importantly, I guess the next steps are going to be define mission, vision, goals that go into an RFP and that and a time frame. I mean, what are the next steps?
Sure, so I can explain that. So we've already put together a basic cost structure of what the district costs are going to be, what we expect the district costs are going to be to operate the property. Now, there's a lot of details we obviously still need to fill in because this is a property we're purchasing, but we are not operators.
Right.
We do not wield the expertise to do this justice and what the community deserves to have an exceptional women's sober living residence in our community that accommodates 30 people. So the next step is pulling in some expertise to help us with the RFP and making sure that and all the proposals, obviously, will be brought in front of the trustees. We will thoroughly evaluate. There's a lot of details that need to be worked out, obviously. We have no expertise in this, but the people who will be operating it will. So there's many questions surrounding what it's going to look like, how it's going to operate. We'll have a chance over the next few months, several months, to evaluate that. And then I'll bring all this to the trustees, and we'll talk through it. We'll have plenty of time to answer questions, interview the folks who are making the proposals, and decide on that. So again, I'm not an expert in this. None of our team members are. I don't know if our board members are. I don't think so, but I can tell you that I am not. So we need to bring in that expertise. What we bring to the table is an opportunity to bring a service that is in high demand for our area, and we have that property made available and reserved for that need.
And that's not something that, or pardon me, we have done this before with Treasure Coast Community Health or with the Gifford Health Center. We went out to bid, did an RFP, and went through the process of it before. So this is not something new to the hospital district. It's something that we've...
The IOP as well. We did an RFP
Yeah.
for that.
And Michael, the total price was $3.8 million.
And if my recollection is correct, when Anne Marie Soriano was our executive director, we explored this option and couldn't find anybody that was willing to come in and set up shop without property being made available to them. So there are interested parties out there available for us, and this is a function, as I understand it, of that process. I think I came in on the end of that conversation, but my recollection was that we couldn't find somebody to set up shop, so we had to build a shop for them.
I think we've all been aware of the need, and this isn't like, my starting point isn't, we need to do this now. But just in terms of a general timetable, I was looking, and if it's going to take 6 months to get there, it's going to take 6 months. We need to do it right. We need to make sure that whoever gets brought in, who's ever going to manage this program.
Correct. Michael, let me add a couple things to that, if I could. Yeah. So, with the property, it worked out very well because we were able to secure the building and the grounds are in fantastic shape. We were also able to secure furniture and a lot of other equipment as part of this Yes, there's a ton of work that needs to be done to bring it up to speed. These are relatively new buildings. You know, we made allowances for the roof. I mean, all this we worked into the deal. The roofs on both buildings, looking at the end of life. So this was thoughtfully planned. As far as, and you know, what we're going to have a chance to evaluate, you know, we're going to have a chance to evaluate, you know, the folks who make the proposals, but realistically, we'll start working on the RFP process next month and getting the expertise for that to help us put that together. And then we'll go from there. I hate to put a timeline on it because I've never done a project like a women's sober living before. I mean, I don't, but I know there's going to be a handful of potential suitors. And then we'll just have to look and compare the deals and see what's going to work, you know, best for the interests of the community.
Heard.
I think I have 3 items. One is the iffy one. Cleveland Clinic made a huge announcement today, and I don't want to steal anybody's thunder before I bring something up for Frank to take care of for us. Am I stealing anybody's thunder today? Okay. They announced the opening of a hospital in Palm Beach County and an expansion of their facilities there. I'll read the statement of Dr. Mandel, CEO Chair. Our expansion will transform care from the community with a new hospital and outpatient clinics that provide a broad range of specialties, greater access, and innovative patient experience programs. We have started an accelerated fundraising effort with the support of many visionary and compassionate Palm Beach County residents. I'm bringing this up just with the idea that perhaps we could have Frank prepare a letter of congratulations to Dr. Delaney and Dr. Rothman for Mary Beth's signature before the 31st gets here.
One last duty?
No, it is a big thing, and here's a classic example, okay, of that dual role, right? I mean, I have been aware of them working on this.
You could have cut
for a
me
long time.
off.
Huh?
You could have cut me off. You know what I was saying.
Oh, no, but I'm just saying that, you know, I've been aware of it, but I've not been able to mention that until they actually come out and do that. But this was actually at a request of the folks in Palm Beach. They came to Cleveland and asked them if they would do something. So, interesting.
Do I need to make a motion for that letter?
Do you,
Go for it.
I
Do
move
it.
that we have Frank prepare a letter of congratulations directed to Dr. Delaney and Dr. Rothman and their staff regarding the planned development of a Palm Beach County hospital, and that it be finished in time for Mary Beth to be the signatory on our behalf.
I second.
all in favor?
Aye.
Aye.
You have 3 things.
Oh, yes. The second one, I'm going to bring it up again. I know, Karen, you moaned the last time or groaned the last time I said it, which is our funding process is getting ready to get started soon. And Frank, I know you've been working on our guidelines, the macro guidelines and the micro guidelines. Where are we on that, and when are we going to be able to see that?
Yeah, Paul, we've made significant progress on that, talking through it internally. I owe that back to the trustees for us to finalize that. The plan was to get all that set up in place as we also adjusted, improved some communication with the funding process for this year. So you will see that within the next 30 days before we start the funding cycle.
Okay.
And we need time to deliver. We need time to talk through it too.
And then the third item is the possibility of streamlining our funded agency reporting. And in order to improve our time efficiency so that perhaps we may have more capacity for strategic planning, thinking, and so forth. And what I have in mind, and I'm not making a motion, I'm just bringing this up, and perhaps, again, by consensus, we can say, hey, Frank, can you take a look at this for us and see what you can come up with? But with the agency reporting, we have a number of them that just give us the written report. And maybe we could have a standard that we get the written report, we review them. If any one of us wants to have the agency come forward and answer questions and address us, or if staff sees the need, we will, or if the agency feels the need, but otherwise some sort of a standard operating procedure where that's concerned in order to streamline our work time.
May I? So we have internally, I know Jenny's smiling, we've been working on this process now for a couple months. I wanted to make sure we had the 4 questions, we had a process in place that was going to cover all our bases. We were going to test it out just internally before I shared it with the trustees and walk you through it. There's no question we need to improve the efficiency there. That's been on our minds as well.
Thank you. That's it.
And I had one other thing, if I may, and this is because it's referenced in Frank's report, and it's an item that came up in discussion yesterday at the chairman's meeting, and I was pleased to learn that there's already been discussion and movement, and it has to do with trying to streamline, improve, make it easier for those who qualify for hospital district support to get it. We heard it in Vicky's report very, very clearly. I mean, it was worthy of the discussion it got, and you said you've already been talking. I wanted to just say something because they're probably not watching this meeting now, but the reality is perhaps someone in the press that is, could just make reference to the fact we are aware of the challenges that exist with that Alice population and any number of others. There are so many more people that we could be helping if they can get qualified, and an effort's already underway to streamline that, make it better, easier for the public.
Indeed, and Michael, if I could just tag on to that. This isn't just a one and done. What's really important is because of the relationships that our team has with the funded agents, with the agencies that we support, it's always changing and evolving in the sense that we can't create a process, okay, this process works now, we've streamlined it, it's easy, we'll put it on a shelf for 5 years. No, we have to have constant, and we have that constant communication. It has to be ongoing improvement all the time. We have to make this seamless, we need to make it easy, we need to make it efficient. So that's on our mind, and these are all things that, in addition to everything else we've done this year, we're preparing for next year, so.
I would just ask on that, and since I'm not going to be involved in it, but that you keep the trustees involved if you make major changes to what the requirements are.
Of course.
I think that that's really important because people do ask occasionally, how do people get qualified to be part of it? And trustees should be well aware of that.
Will do.
Any other comment for?
One other comment back on the women's sober living and the RFP in particular. I think there might be helpful to have some strategic discussion on what that RFP looks like from the trustees.
Please.
That there may be some non-negotiables that we have that need to be in that RFP. I think the trustees need to have a conversation about what are our goals for that, and make sure you mention mission and values, et cetera. I think that would be a really healthy discussion that we are all on the same page before we go out to public and start looking for partners.
Yes, will do.
Okay, anything else for Frank? Okay, hearing nothing, we have a funded agency report, and Lundy, welcome from the VNA.
Good afternoon or good evening, trustees. Thank you for allowing me to present to you today. It is an honor. But before I begin, I would like to take a moment to thank Mary Beth, really, for all that she has done. She has provided incredible leadership to this board for the past, I know, since 2018. I don't know about before that, but at least since 2018 for sure. The other thing is that Mary Beth has really led this county through the most important healthcare delivery decision that has ever been made. And I think she did an excellent job of that. So I remember just being at the IG Center when you had that huge, you remember that meeting?
Yes.
But I thought that was just the way that you, just even as a citizen, a private citizen, just watching you go through that process, I think it was exceptional. So I just want to say thank you for that.
There's a lot of people involved in that.
Correct,
It's
yeah.
the whole thing.
But it takes a leader, it takes someone to pull the troops together to make things happen. From the VNA's perspective, I just want to thank you so much for all you have done for the VNA. We have always appreciated your unwavering support, but knowing that we had to earn every bit of it as well. So we appreciate that too. So you're going to be greatly missed. So Okay, so we have 4 questions. The first one is about what have you learned as an agency over the past 6 months? We've been learning a lot, but I just identified 3 learnings. Number 1 is that we need to connect with a wider group of like-minded agencies, and we've been talking to agencies not even in our county, but even in other counties to find out best practices and things that are going on in the counties surrounding us as well, in order to bring and address the issue of whole person care, continuum of care, to keep people aging in their homes, keep them out of the emergency department, yes, Dr. Mackin, keep them out of the ED, and also out of the skilled nursing facilities. Those are high-cost care settings, and we need to do everything we can. So in our futures planning, we are considering that as well. So the second learning is that back in about this time last year, we added a focus to our home health business to really try to identify hospice patients sooner. And as you know, there's a lot of misinformation around hospice and a lot of myths around hospice, and we've been working for years in 32963. We went for several years on our hospice myths, and if you remember seeing that in the 32963. But what we've learned is that home health to hospice is a bridge too far for too many people. And so, one day, mom or dad's on home health, and then the next day, someone's talking to them about hospice? What? I didn't know mom and dad was that sick. They might actually be sick enough, or their terminal illness might be coming sooner than they think. But no one, and so the patient actually physically meets criteria for hospice, but they may not be mentally or emotionally ready for hospice. So in order to address this, we are, in earnest working on a palliative care program. So I just want to make you aware that is something that we are moving forward with. So if we have a patient on palliative care, and that seemed like a much gentler word, and if you read the definition of palliative care, it really is hospice. It's just said in a nicer way. But when patients are in our palliative care, they can transition to hospice seamlessly and receive all of the hospice care benefit that Medicare provides.
My dad's been on palliative hospice in Melbourne for about a year, and
Really?
it has
Yeah.
been a wonderful thing for us and for him, no doubt.
Exactly. That is,
When my sister said hospice the first time, I said, "What?" I had the same response.
correct.
I even knowing that they have palliative, but it's a great opportunity.
Thank you, Paul. So the third thing is, and this is probably not going to surprise anybody here, but a lot of people have no clue about what advanced care planning is. And so we've actually done some formal market research and I've identified, the obvious, right? But anyway, we actually have market research to tell us that it is an issue. So as you know, we've had an advanced care planning initiative at the VNA for about 5 years. And so currently that initiative continues to move forward. We're promoting it, supporting it as much as we can to try to get the word out. And so that is continuing. So we have Lisa Sellers, which is our nurse practitioner, Candy Alexander, our social worker. They are typically the team that goes out and has these advanced care planning conversations with usually seniors. And I was actually able to attend one of their sessions this in the past 6 months, and they just do an amazing job. So, but we are continuing to push that effort forward, and our foundation just launched a program called Getting Your Ducks in a Row. So if you haven't seen this, they're providing a 3-week workshop. They'll go over the first 3 weeks in January, I believe. And in those workshops, they're going to talk about advanced care planning. Advanced care planning will be one of the things they talk about. They're going to talk about other parts of sort of planning for that end of life. So that is another initiative that is moving forward. So those are like the three learnings. One of the learnings, did lead, so in question 2, what information did you learn that made you do something about it? I told you in the learnings what we're doing about some of those, so I kind of covered that one. All right, question 3. So emerging issues. So basically the way I tackled this is I combined 3 and 4 together, because some of the trends and emerging issues that we're seeing, we're working on those. I'm working on those with the board to try and come up with plans on to buck some of these trends. The first trend it's not related really to healthcare, but it kind of is because we want our team to be unified. So according to a recent Gallup poll, 80% of the people polled agreed with the statement that Americans are greatly divided. So when you have people coming to work that are greatly divided, you don't want to continue that division because we got important healthcare work to do. So typically during our political season is when a lot of these divisions get promoted. So at the VNA, what we've been doing for the last several months is saying there's no political talk allowed in the building. We know that people have party affiliations, but we just leave those at the front door. When you walk through the building at the VNA, you are in the party of providing the highest quality of patient care. That's your new party. So when you are working here at the VNA, all we want you to do is to be concerned about how you're going to provide the highest quality of patient care. So we have eliminated all of that external noise coming into our practice, and so we are just focused on delivering on our why statement, which is providing the highest, our why statement is providing patients with optimal quality of life at all times. So people ask me, so what does that mean? Well, you have an 87-year-old woman who just had hip replacement. So I was in her house with one of our PTs on one of her therapy appointments, and optimal quality of life for Marge was standing at the kitchen sink washing dishes. Because for Marge, that's back to normal. That's she's doing something that she used to do before she had her hip replaced. For a gentleman who had a total knee replacement, 82 years old, all this person wanted to do was take the trash out to the front of his driveway without an assistive device. That was optimal quality of life. So we're defining things differently at the VNA. And someone in the hospice house at end of life, that optimal quality of life might look very different for them. That's just keeping them comfortable, pain-free, just allowing them to just have that just calm transition into the next life. So that's one of the things that we're doing at the VNA. So we're going to continue to drive the unity message at the VNA. There's too many messages about what makes us different. We want to focus on what makes us the same, what unites us at the VNA, and that is about driving the highest quality of patient care. So I would encourage all the community leaders to be out there in your businesses, in your agencies, to really be driving unity on what you can do to help people in this county. So that's our first, what are we calling those, emerging issue? All right, the second one is directly related to healthcare. So the growth in Medicare Advantage. This is an issue in our country. According to the Kaiser Foundation, 54% of the Medicare eligible population in this country are in a Medicare Advantage plan. That means 46% in Medicare, original Medicare, 54% in a Medicare Advantage plan. That's almost 33 million people. It's a similar split in our county as well. The reason that this is such an issue is that the Medicare Advantage insurers pay very low reimbursement to providers. It is absolutely ridiculous. And according to Becker's hospital CFO report, 32 health systems this year dropped Medicare Advantage plans in their health systems. We're not talking about one hospital, we're talking about systems. And I have a list of all 32 if somebody wants to see them. But so that is a real issue, and I would expect that healthcare providers in this county, and I know we're experiencing at the VNA, are experiencing these same issues, that there's the prior authorization, the amount of effort we have to get in to authorize anything and a lot of times it ends up in a denial, which is really annoying. And the other thing is that these Medicare Advantage plans, they pay so slow. We have waited almost a year for some of our reimbursements. The reimbursements are low, and then they don't even come for almost, sometimes 12 months. So it's been absolutely ridiculous. So I would expect that we're going to have the same issues in this county, so things that we're going to have to look at. At the VNA, we actually had to cancel one of our Medicare Advantage plans that we had. The contract was below our variable cost of a visit. So when it's below your variable cost, then, I mean, that's absolutely ridiculous. If it's above your variable cost, you know, you can have some visits that'll help cover some fixed costs, but eventually you've got to get the rates up higher to cover all of your costs. So we are continuing to ask for higher rates of our Medicare Advantage plans. We've only had one provider in the last 18 months that has given us a small increase, but at least we're making about $10 on a variable basis on a visit. So we're hopeful that a new organization that has just started in the U.S., there's been a combination of the National Healthcare Association with the National Hospice and Palliative Care organizations. They have come together. So we'll think to have a much stronger lobbying voice in Congress. There is some traction in Congress right now. They are starting to understand that Medicare Advantage might not be the best plan and way to go for Americans in the future. So we're hoping that Dr. Steve Landers, who's a good friend of the VNA's, is going to be in Washington really pushing hard to get this Medicare Advantage to really make sure that our CMS and the people running these programs really understand the impact that they're having and the negative impact that they are having. But the fact that 32 systems canceled their contracts, we had never seen that prior to this, that a health system actually canceling Medicare Advantage plans. So number 3, another emerging trend, it's not really emerging, it has been around for quite a while, is the growth in for-profit hospice agencies. Now, this is obviously not an issue in our county today because the VNA Hospice is the only hospice program where we're nonprofit and we're community-based, compassionate caring. But that is not what the rest of the country is experiencing, and it will probably change in this county at some point as well. So the first hospice program was started by some Yale doctors, nurses, and clergy in 1974. Then in 1982, Congress actually passed and created the Medicare hospice benefit. That's like one of the best things Congress has ever done in the history of this country. Initially, hospice programs were run by nonprofit agencies. Even VITAS, who we know as the big for-profit, started as nonprofit. And they switched to a for-profit in 1984. So they ran for 6 years as a not-for-profit, then they switched to for-profit. So when hospice started, 100% of the patients were being served by compassionate, community-based care hospice agencies. Last year, or this year, the latest number on this year's, 77% of the patients in hospice are being served by for-profit hospice agencies. And there's a lot of noise and backlash and feedback that they are not serving the patients as well as they should be. They're only providing the very minimal hospice benefit, which is a nurse, social worker, and spiritual support. So, and they're just doing the minimum visits, the minimum everything. And so there's a lot of concern about that across the country. The VNA Hospice has been in business for 40 years, providing compassionate, community-based hospice care. So we're thankful for the well-thought-out Certificate of Need system that we have here in Florida, but we are faced with someone who wants to get into this market right now. So there is that threat of a for-profit hospice agency coming into Indian River County. So what we're doing about it is we're working on plans to safeguard our hospice benefit here in Indian River County. So we're working on ideas and plans to make sure that there's always that hospice opportunity here for patients to have a community-based for-profit, not-for-profit hospice program. So that is my third and final emerging trend and what we're doing about it. So I'm happy to take any questions.
Lundy. Here.
Yes.
Very nice presentation and nice moves in the direction of future planning. Tell me, though, a little bit more of your end-of-life planning and the palliative care. Are there more nurses being brought into this field? And what about physicians related to palliative care? Do we have anyone in Indian River County who assists in that regard?
Correct, yeah. So this is where we insert Michael Sapola, is intimately involved in creating our palliative care. Mike, you want to come up and answer that question for us?
So the program we're looking to implement is a little different than what's out there in the industry. Our program is really looking at more of a medical disease management process, which is really what palliative care is. People associate end-of-life palliative care, which is treatment with morphine and things like that to treat immediate symptoms to help people transition as palliative. That is palliative. But we want to also palliate people who have end-stage heart disease, end-stage lung disease, other types of diseases that will help improve the quality of life, even though it may not be long, but they're not ready for hospice. Keep them under our care, keep them under our wing, and provide them with the services from social work, physician, or nurse practitioner to get them into a safety net that doesn't exist anywhere in this country. The VA's got a program, but it's unique to the VA, and it's not everywhere. As far as a physician goes, we are working with a physician trying to get him on board with us. We have a nurse practitioner, Lisa Sellers, and the team will start with that combination. We provide home care, because we're in a unique position. We have home care hospice, which will support the palliative program, which will stand in the center. And so our home care agency will be able to provide palliative care to people who are not at end of life. And then once they do need end-of-life care, we can transition them into our hospice program seamlessly.
Thank you.
Thank you.
Thanks, Mike.
Lundy, I had a question. It was on maybe one of the first graphs that you put in the packet we got, hospice services review, review of hospice days and physician visits. And my questions, I circled physician visits. I'm just trying to understand exactly what this is showing me. Room and board, routine, total days, and then I see this really small, 2 physician visits, 5 physician visits, 7, and I want to understand what that is or isn't.
All right, Pat, put this chart together. I'm going to ask her to come up. Yeah, she's
Right,
pulling
on
up
that
right now.
same graph, there's a GIP. What does that stand for? Which
Yeah.
Yeah, so GIP is general inpatient, so those would have been patients that would have been in our hospice house.
Okay.
Yeah.
Hi, everyone. Hello, Michael. So, sorry. So I hope I can answer your question, and not quite sure what you're asking, but what we do for that period of 6 months, from April through September, is we detail out the number of days that, because you reimburse us by the number of days and the type of hospice days that the patient was in a program. So it doesn't represent the number of people that we took care of, it represents the number of days. It could be 3 people. I could get you that data if you'd like to know how many people actually are represented here.
No, but that's what I thought I was looking at, to be honest.
Yes.
So I appreciate understanding that.
Yes.
How are we reimbursing for a physician visit?
It's a fee for service, essentially, yes.
Because
When the
it's
physician
pretty
comes-
nominal,
Yeah.
was the point. so it doesn't happen very often.
Not really, because we do have a staff of
Yeah.
RNs and APRNs and social
I
workers.
just wanted to understand what I
And
was
so,
looking at. It
yes.
just didn't make sense to me, so
Yeah, but we would be happy to, in the future, give you the number of people that are actually associated with the number of days spent on each type of service as well. Okay,
thanks.
I'm sorry? Oh, perfect, okay, it's already there. Sorry, I didn't even realize it's already there.
Yeah, and the other thing, Michael, is the physician admits the patient, and then if they're going to be recertified, they will see him in 60 days. So it's not like they're receiving a physician visit
Right,
every week.
right.
Once the physician admits the patient, then the nurses take over.
Okay.
Thank you, Pat.
I have a question
Any other
for
questions?
you.
Yes.
Where do you stand on the land?
Where do we stand on the land? Yes.
Yes.
So, good question. So, as you know, we had a big effort last year or earlier this year to purchase the land. And we have been through a process. We've been living the dream of the land, and then COVID sort of took some of that dream away and extended the dream even longer, so that we could be in a place financially that we could really support building, as we always talked about, building a VNA operations center on that land. So that's always been like Plan A. It's the situation is, though, that we didn't feel like we'd be responsible in moving forward and spending roughly in the 20 million range would be the quotes that we received from Proctor Construction on actually creating that operations center. So as you know, since then, we've been very happy over at Park 24. And so but we have still the idea of creating the VNA Operations Center, and we have other ideas on how we can use that land for the betterment of the community, taking more of a holistic approach, not just a VNA approach. And so, so we are thinking through how can that land be used strategically to serve the seniors in this community. So I've been working with some plans that's quite confidential at the moment, but working on plans on how we could bring those types of ideas to fruition on that property that would be focused solely on serving seniors.
So,
And also the caregivers that are taking care of the seniors as well.
I get asked quite often about that land because it's a prime piece of land, obviously. Are you open to talking to other people about uses on that plan?
Yeah,
On
so
that
we've had,
land?
absolutely, yes. We have talked to several other nonprofit agencies. We would, prefer to really talk to nonprofit agencies that are serving seniors. So that's kind of where we are in terms of the criteria that we would use in engaging in conversation with someone about wanting to use that property. But we are going to use it on March 22nd of next year, so please put this on your calendar because you're all invited to our 50th birthday party. So please come celebrate with us March 22nd. It's going to be from 12 to 3, and we're going to put a huge circus tent on that property, celebrate the VNA's 50 years, and celebrate that we're on this property. This is our future. And so we're really excited about what we can do with that property to really serve the seniors in this community.
Any other questions for Lundy? Thank you.
Thank
All
you.
right, thank you, Mary Beth.
Thank you. Any unfinished business with trustees?
I do.
Yes. I thought you might want to talk.
It's not as good as Mary Beth's, but it's only because she copied mine, so mine just a little bit. No, really, it's been my honor to serve the residents of Indian River County for the last 8 years. When a couple people came to me and asked me to do this, I was like, whoa. And I researched it a little bit, probably not enough, but decided to throw my hat in and got elected and then re-elected 4 years ago. I thought long and hard about another 4 years, but you know, this crazy dog lady has to do some dog stuff, so I decided to stop for a little bit. But really, to all of the trustees, it's been a pleasure to serve with you guys. I'm going to miss you. Maybe if Frank gets some committees together, I might step back in on that end of it. I think I can work that around the schedule. To Frank, Jenny, Kate, Dawn, and Caitlin, you've heard it before. The staff is small, but oh so mighty. Thanks for everything you guys do. To the trustees, and I said again, I really, really appreciate serving with you guys and hope to see you out in the community. Jennifer, I'm going to miss her being my neighbor, or she'll miss being my neighbor in the future meetings, but also for all the help that you've given me with legal counsel for matters of the district and being so efficient in answering those things. To all the agencies, keep up the good work. Our residents here in this county are so fortunate to have as many funded agencies as we have. So many counties just don't have that. So again, keep up the good work, hold true to the district, and they'll make sure you're taken care of. Thank you.
Thank you, Barb.
I'd like to say something as well to the both of you. I've had the fortunate time to spend 8 years with each of you, and went through a lot of different situations during those 8 years, and you're leaving me behind now. I mean, this is it. But I want to say thank you for the time that we spent on the board together in the last 8 years. Your calmness, your thoughtfulness, decision-making, it certainly brought a lot to this district and to the community especially. So thank you. Thank you for everything you've done, and thank you for letting me be part of it.
Thank you.
Barb and I already agreed we're coming back to the January meeting, so we get to sit with Anne Marie now.
I've already picked my seat out.
Like we both have said, it's been an honor to be here, so. New business, Jennifer.
Okay, I have two resolutions to read for adoption. So I'm going to begin with Resolution 2024-06. Whereas Mary Beth Cunningham was elected to the board in 2015, re-elected in 2019 and 2023, and has served with dedication and distinction as a trustee of the Indian River County Hospital District for 10 years. And whereas during her service, she served as an esteemed chairman of the board since 2017, a dedicated ex officio member of the Cleveland Clinic Indian River Hospital Board of Directors, board member on the Mental Health Collaborative, and has served on numerous other boards in Indian River County. Whereas her guidance and input on board governance and community matters were essential to the decisions made by the Board of Trustees of the district. And whereas her direction on indigent care issues and negotiating efforts relating to the Cleveland Clinic partnership and provision of health care services in the community was helpful to both the patients and the taxpayers of Indian River County. And whereas her leadership and oversight brought value and direction to strategic planning and overall activities of the district, Ms. Cunningham's business and operations background brought reassurance to the board and accountability to the taxpayers. Now therefore, be it resolved by the Board of Trustees of the Indian River County Hospital District that the Board of Trustees, on its own behalf and on behalf of the citizens of Indian River County, and particularly those who are served by the district, express our warm and heartfelt thanks to Mary Beth Cunningham for her efforts and exemplary service as a member of the officer of the Board of Trustees of the Indian River County Hospital District. She will truly be missed. The undersigned members of the Board of Trustees of Indian River County Hospital District hereby certify that the foregoing is a true and correct copy of a resolution duly adopted by said board at a meeting of said board held on the 19th day of December, 2024. And I will need each of you to sign this, so don't run off as soon as we're finished, okay? All right. Can I have a motion to adopt Resolution 2024-06?
Second.
Second. All in favor?
Aye.
All right, motion carries. Okay, we also have Resolution 2024-07. Whereas Barbara Bodner was elected to the board in 2017 and re-elected again in 2021, and has served with dedication and distinction as a trustee of the Indian River County Hospital District for 8 years. And whereas during her service, she was a conscientious assistant secretary and secretary to the board and served as the chairwoman of the Gifford Health Center Advisory Committee for 4 years. And whereas her guidance and input on board governance and community matters were essential to decisions made by the Board of Trustees of the district, and whereas her direction on patient-first issues and negotiating efforts relating to the Cleveland Clinic partnership and provision of healthcare services in the community was helpful to both the patients and the taxpayers of Indian River County. And whereas her leadership and oversight brought value and direction to strategic planning and overall activities of the district, Ms. Bodner's clinical background brought reassurance to the board and accountability to the taxpayers. Now therefore be it resolved by the Board of Trustees of the Indian River County Hospital District that the Board of Trustees, on its own behalf and on behalf of the citizens of Indian River County, and particularly those who are served by the district, express our warm and heartfelt thanks to Barbara Bodner for her efforts and exemplary service as a member of the Board of Trustees of the Indian River County Hospital District. She will truly be missed. The undersigned members of the Board of Trustees of the Indian River County Hospital District hereby certify that the foregoing is a true and correct copy of a resolution duly adopted by said board at a meeting of said board held on the 19th day of December. Can I have a motion to adopt Resolution 2024-07, please?
So moved.
Second.
All in favor?
Aye.
Thank you very much. Resolution carries.
Thank you. Any other business of the trustees? Any public comment?
Yes.
Yes. Please come up to the microphone.
Can you hear me?
Yes, we can. Thank you.
My name's Bill Schroeder. I think the only person I know here is Michael Kent from working for him at the United Way. I do want to congratulate, from my previous experience, that you seem to be practicing term limits. From my practice in the past, that was the single biggest reason we got called in for help, because there was no term limits. There's a little old saying, it's easier to correct the other guy's good deeds than correcting your own past good deeds. So the reason I'm here is I wanted to change the topic a little bit. We've been here since the 90s, and that's talk about capacity. We've been talking about some of your quality efforts, and they're excellent. But I see capacity as a #1 problem here. My wife and I have both spent time all night in the aisles on a cot in the hospital. It sometimes takes us months to find a new doctor. We're under capacity, but more than that, you well know that your counterpart in the county are planning for this rocket growth, this 9-point growth plan, 50,000 new residents in the next decade or so. You can see the evidence now all over town, building, building, building. And I don't see anything in the newspapers talking about capacity. And I see your friends to the south are building a new hospital. Cleveland Clinic's put $100 billion into this town. I don't know if they're going to put any more money in, but someone I would think in this town would be doing something about it. You can raise a couple $100 billion in this town if you want to, but I think it takes a little time to get the money together. And I just don't hear anybody talking about it. Now, I don't know if that's your business or not, but given this meeting, it doesn't seem like you're concerned about the capacity of health care in the county. So that would be my comment. And I'm going to try to see if I could get some of the newspaper articles to write about this problem and what you're doing about it and other people are doing about it. I think 10 years from now, and look at, we're trying to break the building height. These two stupid chimneys out in the big development. Well, 10 feet now, 10 stories in a decade from now. You know, there's plenty of money going on to try to get those chimneys built to break all our 3-story limit that's helped this town so much. So there are a lot of things going on. And I don't see, I mean, it's very clear what the county wants to do. This 9-point rocket program is going for broke. In the meeting I was at, some of the townspeople said, we don't really want to be like other bigger counties. I asked the person presenting, what's your vision for this town at the end of this program? You know the answer I got? We'll learn what it is when we get there. So please think about capacity. Thank you.
Thank you.
Thank you for that. I would like to reassure you as well that capacity and bringing in new providers is on the strategic plan and has had a lot of conversation with this
But
group.
it wasn't on the program tonight.
Not, it was not on tonight. I agree with you. Thank you for your comment. Any other public comment?
Is any and all public comment? It's not specific to any one item?
You're welcome to come up and public comment. Absolutely.
Hi, my name is Michael Franchek, and I am an Indian River County resident and a taxpayer. I was compelled to attend tonight's meeting after reading about the, in the press about this CCIRH bridge plan. That's what I think y'all refer to it as. And I wanted to first say that I think that, you know, some of the comments I read in the press were that with the chairperson leaving, that this needed to be voted on right away. And I think that any time that these types of massive financial decisions are made under pressure, that it's problematic. This is an incredibly large amount of money. I'm not a finance person, but I have done a little bit of diving into this. But apparently, this massive support of Cleveland Clinic would wipe out all of the district's reserves, which I think, you know, there are, I wanted to first say that I'm just learning more about this as a relatively new resident in Indian River County. The efforts that you make with the other agencies other than Cleveland Clinic are remarkable. I mean, the senior care, the sober living, these are all really desperately needed community things, and I think it's wonderful to see the district supporting these initiatives. They're very badly needed, and I think all of these have great importance to the community. One thing that I wanted to bring up, and this is just a matter of record from, you know, sort of a brief look at finances, if you'll pardon me for a moment, is that Cleveland Clinic is asking us for, I forget what the number are, something around $4 million a year. I could be wrong, but their annual revenue is $14.5 billion, okay? So these people are asking the taxpayers of Indian River County, this massive leading healthcare organization, is asking us, little taxpayers of Indian River County, to support their shortfall. I had a mentor in business school that used to use a term that stuck with me quite a bit. It said, if you're not in the room, you're not in the deal. And that speaks to transparency, okay? When an entity, when I go to borrow money, I've borrowed money a lot. Matter of fact, one thing that I think about is when I borrowed money back in 2008, I was a real estate developer in Southern California. And I used to call up community, can't remember the name of the, Countrywide Lending. They received a lot of bad press after the 2008 time period. I used to call up my rep from Countrywide, and I'd say, hey, Jim, I want to buy a house. And he'd say, okay, Michael, just send me anything you want, stated income, doesn't matter. How much you want to put down, 2%, 1%, no percent? I think that post-2008, we all look at what the lack of rules in lending did to our U.S. economy. We've seen the U.S. economy littered over the years with many bad decisions, either lending money to companies that we thought we knew, that we really didn't know, or just not doing proper due diligence when going down a financial path. So in terms of this expenditure that's being asked for, I've not seen a request. I'd be interested to see the request that came from the hospital asking for our money. Because, you know, normally, I don't know, nowadays when I go to buy property, I have to fill out an incredibly large amount of paperwork in order to receive any sort of loans. I've done a lot of government contracting over the years. I've responded to a lot of RFPs, and I've sought and received a number of grants in my time. And each and every time there were strict rules that had to be diligently followed in order to
You have 1 more minute, please.
thank you. In order to have my application processed. And so I would ask you, the board, and with your vast knowledge of how these things work, is to really, really think hard about this massive expenditure and think hard about what it means to us, the small taxpayers. We don't have $14.5 billion in annual revenue. We don't make $911 million in annual profits like Cleveland Clinic does. We're just normal people who go to work each and every day and make our contribution to this community. And I'd like you to consider that before ever embarking on any sort of consideration for this matter. Thank you for your time.
Thank you. Any other public comment?
Just wanted, Val Zudans, I just wanted to make, I was trying to send an email, and I went on the website, and there's no ability to email the different members, and so hopefully you got the stuff I sent, and
We did.
if you
We did.
didn't,
We
please
did.
share it with the
We
rest,
did.
because
And
I
read
think
it.
there's some
Thank
stuff
you.
that a lot of people would have liked to express, but anyway, that's all I want to say. Oh, I did want to say something about, I was curious, I didn't come here about this, but talking about the sober homes, and the comment that there's nothing like this in our community. Before you guys went and bought a $3.5 million house to put in a sober home, did you do was there any market research done on what kind of sober homes are here? Because there are, you can just Google right now, how many sober homes are there? How many beds are there in this county right now?
Are you, if you're asking me the
Yeah.
question, yeah.
You're the one who said that there's nothing like this in the county. So I'm asking you, how many sober home beds are there in our county?
Well, the first thing I'll say is, when I said there's nothing else like this in the county, what I was referring to, I started in September of last year. This has been underway for a long time. But here's what I can say, is that having a 30-bed women's sober residence in our community that accommodates 30 people, that takes the insurance that we do, that's solely dedicated to women, there is not another one that is that size, that capacity, that does that for people like I've described.
Okay, but how many sober home beds are there in this county?
I don't have that information in front of me.
Okay,
I
is
just
that
want to
relevant?
remind you guys, this is public comment, so you don't have to respond, you can take it under advisement. But certainly, if you want to respond, you may.
Why would you advise someone to not respond to a question from the public about something that you just spent $3.5 million to do?
I'm not advising.
Are you trying to, direct it away from him answering my question?
No, I'm simply following the rules for public comment, and that just is that they will take it under advisement, but they can certainly respond. I was starting to say that. If they wish to respond, they may, but they don't have to. They can take it under advisement and respond at a follow-up meeting if we don't know the information at the time of the question.
So I guess my question as just a general public taxpayer, you go online right now and you Google sober homes in Indian River County, you're gonna see a whole bunch of things advertised in there. I know for a fact that there are sober homes in this community. They're not a single facility, they're more like individual homes, and there are other places, and they might even be in your neighborhood and you may not know it, okay? And there may be some negatives about that, and it may be better to have it where it's in one place as opposed to in your neighborhood. But that said, to go and spend $3.5 million of taxpayers' money to build a facility without doing an analysis of, is this actually a need for our community? Is it a need that we need to meet? Is this actually owning facilities? Is that really the mission of this hospital district?
Yeah, but first, let me answer. I do want
Yeah.
to say one thing.
Yeah.
First of all, nice to meet you, Dr. Zudans.
Yeah.
I've been in healthcare 30 years, and this is not, women's sober living is not my expertise. That's why we're going to work with some folks. But here's what I have done. Since September of 23, when I arrived, I have spent countless hours with our sheriff's office, with our city police department, with all our substance prevention, use recovery folks in this county, And they are screaming for the need for this in a way that in the way that we can provide it. So this has been something that folks have been asking for in our community that work with our patient population that we will serve every single day. And that's what I've been hearing. If you've done that, okay.
No, but I didn't spend $3.5 million on a building. So I'm just asking, and it may be that you're absolutely correct. It may be necessary. But to not determine first what is the capacity, what is the need, how many people are they trying to place in these homes if they aren't placing there?
I didn't say that. What I said was,
where's the analysis?
I don't have the business plan in front of me.
Okay,
So,
well, I mean, that's the whole point of accountability from the public. When people are supposed to come up here and ask you, you guys didn't do the business plan. You just said you didn't do the business plan. I think that's irresponsible.
no, what I said, Dr. Zudans, was I do not have the business plan in front of me. I'd be more than happy to have a discussion about what we have, what was produced before my arrival, pull that together, and again, we are, yes, I'd be happy to do that.
So there was a business plan saying that there was there's a certain
Need in the
number
community.
of beds currently, there's a certain shortage of beds, this is the number of beds, we need a 30-bed facility. There was that plan done?
Oh, no, the 30-bed facility, the property happens to accommodate, 30 beds, and we wanted something that was able to accommodate the need that I was hearing in the community. At this moment, I don't have any.
Anecdotal statements from people that, hey, this is something we need?
Well, let me say this. This has been in motion for 2.5, 3 years now. All the trustees are aware of this plan. This is something that has been in motion. I can't answer how many beds are in the community today. I'm sure maybe Women's Sober Living have opened and closed over the past 2 years. But this has been in motion. This is a need that we're serving, and in fact, the need is growing. If you'd like to join me at some of the organizations, come with me, and we'll talk to some of the people who are the experts in this community, and we can talk about the demand. We could talk, we could talk with the sheriff, we could talk with the local police chief, we can talk with others who work in the organizations who serve our population, and they can give you all the facts and the details.
I'm just saying I would have preferred you do that before you go and buy a $3.5 million.
We have
building
done
from
that.
Taxpayer.
Yeah, we have done that. As far as the specific detail you're asking for, I don't have that in front of me, so I can't speak to that, nor can I speak to all the work that might have been done before I was here.
Okay.
Okay?
Thank you.
Yes, come on up.
Hello, Merry Christmas.
Hello.
Indeed.
Happy holidays. I am Sheila Gallo, and I guess I represent 48% of Indian River County as of my election to be a part of this advisory board. Congratulations, everyone. So representing 48% of the people who voted for me, I thought compelled to come here tonight to talk about the same issues that is concerning everybody, which is bailing out Cleveland Clinic. And I'm really, I have the same numbers as this gentleman does, so I'm not going to repeat them. But I can tell you that the people that backed me were very concerned about bailing out the hospital. And, I was very glad that you voted to discuss the conflict of interest issue. And I really appreciate the time the legal person is going to take to this, because I find it very difficult to see members of this board interacting with the hospital in such a way that it's not representing the taxpayers. I see it, and it's nothing personal. I feel like if you're receiving money from this board, you shouldn't be on this board. I made that clear. And it's nothing personal, but I think it's an ethical issue. So we're a hard no for the 48% of the people who voted for me on bailing out the hospital. and a hard no. And we'd like to see their financials, you know, so I'm going to say that. The second part, the reason why I'm here is, I feel like I'm leaning over, I'm working on my posture, is the mental health and the long-term goals. And Frank, you had talked about Medicare and Medicaid and cross-tabbing. And I look at the children's program in here in the behavioral health, and it's very subjective. And I'm gonna start to come to these meetings because I think it's really, really important, because behavioral health is a huge part of your goals, and it's very subjective on how you measure the behavioral health. And you can look on your chart of a perceived experience of behavioral health programs. That's not a way to measure behavioral health. In the crosstabs of Medicaid and Medicare, it's how many children are on psychiatric drugs, and are you getting them off of these drugs? Or are you giving access? You talk a lot. I know all the lingo. I've been doing this for 20 years, and I know all the lingo of access to care. And there's a difference between access of care and quality of care and drug safety. So I would like this board to consider measuring behavioral health based on how many children are on psychiatric drugs. Are you providing an exit plan for these children? And are you providing med watch? Meaning if they have an adverse event from these drugs, that these programs you're promoting are putting children on these drugs, that they have a way to report to the FDA the side effects of increased risk of suicide and increased risk of violence. So the reason why you're having a crisis in mental health, and you need all the people, the sheriff's office is crying out to you saying we need more and more mental health care, is because of the side effects of the multiple drugs that these children are on. It's irresponsible not to look at this. And I am going to come to these meetings and remind you oh so gently that it's a human rights issue. And we cannot expand behavioral health without looking at the impact that these mind-altering drugs are having on our children. So I appreciate all of you here. I do believe that if you are receiving money, Karen, from this board, you should recuse yourself, because as you were talking about the sober house.
Okay, thank you. It's 5 minutes.
Okay, I'll just wrap it up. When you're talking about the sober house or.
Ma'am, our public comments, 5 minutes. Thank you.
Okay, I appreciate it. In any case, if you have a conflict of interest.
Is there any other public comment? Is there anything?
We have some on Zoom.
Okay.
Okay. All right. The first person on Zoom is Ray Osborne. Please unmute your mic.
All right. Good evening, everybody. And I addressed a little letter here just to kind of put my thoughts into gear here. So the Indian River County Hospital District, and it's about the modernization of our healthcare system with virtual visits and electronic messaging, I think is needed, especially the training of medical staff to implement them. And so we can all agree that virtual visits or telemedicine has its strengths, but also its weaknesses, and that electronic messaging also has merits in improving quality of care. And I do have some references here I can give you later from the American Medical Association and from the AARP. During the pandemic, telemedicine or virtual visits was in the heyday, but recently it seems to have tapered off despite the reoccurrence of new COVID variants. There's an article in AARP magazine about a variant called FLIRT, FL_IRT. And besides helping patients social distance from others in the traditional waiting room, there are other benefits like saving time for providers, reducing carbon footprints of patients who have to drive to a new location, as well as the time out of the day to make the trip. Obviously, not all visits can or should be done remotely. And there's a counseling organization publication which goes into more detail about that. My experience with my healthcare televisits, on the most part, has gone very well with both my VA clinics. I'm also a veteran and go to the VA clinic, and also Cleveland Clinic specialists and primary care. But in certain instances, it has not. But it should be evidence, especially with the infection department. In my previous encounter and communication about virtual visits, I've asked the hospital district if they had done a cost analysis to see if capital could be saved. The reply was it hadn't. And now I asked the district members, would they consider cost analysis to have merit to promote virtual visits? My next topic is the electronic messaging. This, when implemented, has speeded up and provided greater accuracy in my continuous health care from providers from both the Veterans Health Care System through Epic to my providers with Cleveland Clinic and the University of Florida Shands Hospital. When it wasn't implemented, like with the infection department, there again, the same department, where it was in fact turned off on me, which resulted in unnecessary appointment that cost providers time and wasted Medicare funding. So there's an article from the American Medical Association, which addresses electronic funding that doesn't tie up a doctor's time if the staff are trained in it. So I asked for members of this committee to comment on these points and if this may be added as a future agenda item. It should be noted that I'm a licensed health insurance broker and understand HIPAA compliance issues. My actions here today is not for my own health care, but for the betterment of healthcare for our community. So that was a little thing that I wanted to send off to the committee there and get your opinions on it. See if we can talk a little bit about promoting more virtual care visits and about freeing the electronic messaging, any kind of encumbrances against that. So I'm throwing that out as a citizen, as a concerned citizen, and as somebody who's a patient. Okay?
Thank you.
Thank
We
you.
appreciate your public
Thank you.
comment.
Thank you.
Okay, the next person is Thomas Jefferson of Vero Beach.
Hello. I guess thank you for taking the time. I just want to remind everybody on the board that you all are all publicly appointed. Okay, so you guys are cutting mics and instructing people not to answer questions. Just remember you all are publicly appointed. Okay, so keep that in mind. Secondly, I've been in Vero Beach for a year now. I have about 5 properties, so I pay my fair share of taxes. And in the short time that I've been here, it's common knowledge, stay away from Cleveland Clinic. They're terrible. You can see the wait times online are terrible. It's almost an hour longer wait time in the ER than the Florida average. You guys have 2 stars on Google. The service you guys provide is absolutely horrendous. And then you guys come to us and you ask us for a bailout of $13 million. Okay, let's see the financials. You guys want to pat each other on the back. We bought a property, overpaid for the property, Okay, fine. Why are you asking us for a bailout then? If you have the money to go do all these things, do it. You provide shitty services. Don't come to us asking for a bailout. The overwhelming majority of Vero Beach residents do not support Cleveland Clinic. Everybody goes to Port St. Lucie or Fort Pierce. And it's already been discussed in this meeting that, yes, conflict of interest, if you're getting money from this committee, which you are publicly appointed to, you should not be getting money from Cleveland Clinic Board as well. And like I said, you guys sit there, you're publicly appointed officials. Remember that. Remember that for next year as well. That's all.
Thank you.
Thank you.
Thank you.
Okay, the last person was Lisa Witakowski. Lisa? If your mic's muted, please unmute your mic. She says she's trying. Okay, well, there's a message in the chat. I think it was from her, so I'll go ahead and just read that. Please stream the district meetings live on YouTube and post after the meeting. And understanding meeting minutes are approved at the next scheduled meeting. Having the video of a reference point is not unreasonable. Currently, the public cannot view yesterday's meetings, and announcements were made that the public cannot refer to today. The district must never relinquish its position of authority and accountability in context to the contract terms with Cleveland Clinic. Early in the agreement, and occasionally over the years, it was reported in some publications, Cleveland Clinic has expressed a strong position for the district to relinquish any reporting duties and other reasonable control. More disturbed are the past current trustees commenting on that position as well. That's it.
Okay. No other public comment?
No.
Okay. Hearing none, and then we will adjourn, and happy holidays to everybody, and have very safe holidays and a healthy new year.
You're here.